Hey guys, Dr. Lee here from Head to Toe Spine and Sports Therapy. I'm here with Dr. Tim. He's got a recent ankle sprain from this past weekend. Tell us about it a little bit, Tim. What happened?
Yeah, guys, so this weekend I was at a CrossFit Fort Vancouver Championship. It was a two-day CrossFit competition. And obviously a lot of load that was happening, a lot of load for my ankle, especially a couple different movements that I think might have contributed to this was a 3.5 mile run, half of that done with a 45-pound plate. And then also just a lot of different movements like jumping, box jumps, that sort of stuff. So ankle's a little bit jacked up right now, so Dr. Lee's going to go into a great treatment protocol that we can use here to kind of help that out a little bit. And this is definitely something that you can run into also, even just with consecutive days working out at the gym. So it's really applicable for anybody, not just somebody who did a CrossFit competition. So.
Exactly. I mean, as you can probably see in this video, there's a little bit of bruising right here, which is typical whenever you have a nice ankle sprain when it's pretty fresh. So what we're going to do here, we're going to use some tools. You've probably had this technique used if you've been in the clinic before. If you haven't, then you will definitely have it be used on anything pretty much. Anything that we have to deal with, like soft tissue work, muscles, tendons, ligaments that might be shortening, we're probably going to use this technique. So I'm going to grab some Receptor here. Some nice CBD rubs can help with the inflammation, help shuttle that out of the area, and also provide a little bit of emollient for us so that it's a lot more comfortable for Dr. Tim. So right now, as I'm going across this ankle here, what I'm feeling is some ridges, some bumps. It kind of feels like almost like bubble wrap, which isn't what your ankle should feel like. So what we're doing here is, for lack of better terms, we're essentially scraping this area. I'm not being too vigorous or too aggressive. What I'm trying to do is signal to the body that we need to heal this area again. So we're irritating the area, but it's for a purpose. We're doing it with a lot of intent. So it's not like I'm just smashing his ankle on the table. It's different than that. So what we're doing here, we're scraping this area, and we find some bumps, we find some crunches, and oftentimes they'll work themselves out as we go across this treatment. So again, I'm not trying to irritate Tim, I'm not trying to make this an ultra painful technique. Sometimes it is, but ultimately what we're going to do is we're going to expand our range of motion here. The main reason why we want to go around this ligament here is because what it's going to do, it's going to limit this dorsiflexion motion here of him pulling his toes towards his shin. And if he doesn't have that, he's not going to be very athletic. He's not going to be able to go into his deep squat like he usually does. And he's not going to be able to just perform, whether that's running, jumping, kicking, whatever it is. So very popular technique in the clinic. Doesn't really take very long. I'd say anywhere from 5 to 10 minutes is pretty typical for an area. And you know it's an effective treatment because those bumps are gone now. So, how'd that feel, Tim?
Oh, good. Yeah.
Cool. So, like I said, if you guys have any ankle sprains, any tendon, ligament issues or maybe you're just like cranky around the joints and you don't really know why, this could potentially be something that we do in the clinic. And either way, I'd like you guys to call the front desk, set up an appointment. We'll see you later.